Hello and welcome to another edition of Newsmakers. I'm your host, Tom Randalls. Of course, this is brought to you by Comcast and WSMV Channel 4. Today we're going to be talking about Medicare, and to help us kind of sort through what it is and how you can get some help and assistance if you need it is Mr. Jim Carell. You might recognize him from television, on some commercials you've done and so forth. Jim, thanks for joining us. First of all, please describe the Medicare Advantage plans that we actually see advertised on television.
Well, these are plans that offer similar benefits to the regular Medicare program, but they're underwritten by insurance companies, and they get their funds from the Medicare Trust Fund. Based upon each person that they enroll, they get like $10,000 plus per year per person to fund their programs.
The difference between the Advantage plans and the standard Medicare, what is it?
Well, the standard Medicare plan is they're funded from the same trust. It's the federal program, and the major difference is in the regular Medicare program, the relationship is between your doctor and the patient. Now, in the Advantage plans, which are underwritten by insurance companies, the relationship is between the case manager, who happens to be an employee of the insurance company or the fund, and the patient. So it's not the same relationship, doctor to patient, as case manager is to patient.
So how do the Advantage plans work?
Well, they receive a sum of money each year for each participant they have. And then they pay the benefits that's prescribed under their plan. And if they pay out less than they have taken in, they are profitable. Now, as I had said previously, insurance companies are in the business for profit, and there's nothing wrong with being in a profit as long as they are providing similar benefits or adequate benefits to take care of the patient.
Okay, so what are the pluses and minuses over the standard versus the Advantage?
Well, the standard, to me, it's important that you have the relationship between the doctor and the patient. It's normally a nurse. A nurse is the person that represents the Advantage plan. And so I'm not sure they have the same relationship there. And that person also, human nature says they work for the insurance companies, and the insurance companies they're employees of the insurance companies. Now, it doesn't say that they're going to have less benefits, but they can be more restrictive.
We have a couple minutes left. Could you talk about CareAll and just sort of describe for our audience what it is and what they need to know about it?
Well, CareAll is an approved agency to provide benefits under Medicare, and we also provide it under a number of the Advantage plans. Some we do not. So we provide in-home care. In fact, all of these companies, whether it's Medicare or Advantage plan, have to work through an agency such as us because they themselves don't provide the in-home care.
You know, this is a confusing subject for a lot of people. What's the biggest question or two that people normally have about how it works or how they get involved or whatever? What is it?
Well, when you're 65 years old, you become eligible. I think they maybe moved the age up a little bit now because you're getting older. The thing that people want to be careful of is don't go for the extras. I know one at one time was offering memberships to the Y. Well, it has nothing to do with your health care. Someone's got to pay for all that. And my experience after 20-something years is I still find that the Medicare provides the most benefit. That's what I have. That's what I've selected myself, and I have pretty good knowledge of all the plans out there.
We've only got about 30 seconds or so left. You want to tell people how they can perhaps get in touch with you, or if they've got questions, where do they turn?
Well, this is the enrollment period for the prescription card until December 31st. And if they will call this number and apply the data, the program will actually give them the best selections. And it's 800-633-4227. And you don't dial a 3, but they'll ask you for that number when you call in.
All right. Jim Carell, thank you so much for joining us today. That's going to do it for another edition of Newsmakers. I'm your host, Tom Randalls. Thanks so much for joining us. We'll see you next time.